Greetings, everyone. Thank you for joining us with our community webinar tonight. I think we might have some crossover between our staff. We just had our staff meeting, staff webinar just prior to this, and we will be repeating this meeting tomorrow in Spanish. And Carlos Ayes will assist me as I took German in high school, so I don't think that's going to help me very much with our Spanish speakers, but I look forward to engaging with our Latinx community tomorrow and addressing some of the same questions that we will be addressing today. So thank you for those of you that got our email and you sent in your questions. We will be recording this and we will be posting this on our website, so it will be available to view asynchronously as you are participating here synchronously with us. We appreciate that. And what we've done is we have collected questions from the community and those who responded. And what I'm going to do is Kim is our Chief Academic Officer, Kim Whitworth, and she is joining me. We have some questions specific to the instructional modality that she can take care of. And we have a lot of questions just about logistics and how this is all going and why I think my overarching sense in previewing the questions is, why are you making the decisions that you're making? So I think, first of all, before we jump into that, I just want to share, we have been meeting, we, Snohomish County School Districts, superintendents and staff at the district level have been meeting with the Snohomish County Health District upwards of the past 6 weeks, regularly meeting with them. Dr. Spitters is on that panel. His staff is all on that panel. And we are taking the recommendations for opening and in the unfortunate situation, if that circumstance happens, closing our schools based on the recommendations from Snohomish County Health. At this time, we have received guidance that it is proper to be planning to return our youngest students. So that is our kindergarten through 5th grade students. We have one of the questions I think that I can talk about immediately is why just kindergarten on the 12th? So we have an agreement. One of the things as a public entity is with our unions, we have to bargain the effect of the decisions that we make if it's beyond the scope of our existing contractual agreement. And the pandemic, I can tell you, is beyond the scope of our existing agreement with all of our unions. And so we have been meeting regularly with our unions. One of the things that we came out and talked to our community about at the end of July, beginning of August, we had a webinar similar to this. We had over 600 community members and teachers and staff and parents attend that meeting. One of the things that we said in that meeting is that we were going to re-examine. At that point, we announced that we were going to be starting online, and that would be distant learning start in September, and that we would re-examine that decision when we got to the quarter. The quarter is November 13th, and so the quarter is coming up. And then we received a document called the decision-making tree, the educational decision-making tree. And this was put together by Washington State Health Department in collaboration with the Office of Superintendent of Public Instruction. And one of the things that was very clear in that document was the directive to serve our students farthest away from educational justice. That began on September 21st. We returned some of our special education programs to our buildings, all of our buildings, sans Sky Valley Education System, which is on a different calendar. But on the 21st of September, David Parator, our Director of Support Services, and his staff began to return some students that were identified through the process of collaboration with our teachers and our schools, our special education staff, really looking at which individualized education plans, so this is our students that are served through IEPs, which of those have been most impacted by the shift to online services. And those students began to have in-person services again on the 21st. We have continued to add programs since the 21st, typically on Mondays. At this time, we have just around 100 students at all 8 of our schools, our 5 elementaries, our 2 middle schools, and our high school. We have programs at all 8 of those schools now that are serving students that were identified as having the most challenges accessing the online materials. In addition to that, one of the conversations that took place between us and our labor union was around our kindergartners, our students that had never been in schools. And so those students, our kindergarten students, along with our developmental preschool program, will begin on October 12th. Immediately, we are working with all 5 of our elementaries to develop and expand the hybrid model. This is in alignment with our reopening committee from this summer, and we're looking at what that hybrid model is going to look like. Again, all of this is going to be contingent upon all of us doing our part. And I would say, as I said to our staff in the previous webinar, please, 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 everyone do our parts, follow the guidelines. I know that there's this concept of COVID fatigue, and I am human. I am no different than the rest of you. My executive director of human resources, Joanne Dickinson, had a very frank and honest conversation with me this week about making sure that I'm always wearing my mask in our facility down here at the district office, making sure that when we're having meetings, we're maintaining that 6-foot distance, we're wearing our mask, we're washing our hands. If we're not close to a sink, we're using the hand sanitizer that's available. We have all of these things in place. Many of the questions that we received have to do with kind of logistics, is what I would label those at as well. And that's, well, how are you doing this? And how are you ensuring this? And what are you doing about that? You all should have received a document that we've been working on the last couple of weeks. We had to really fine tune that document after September 30th. On September 30th, we received new guidance from Labor and Industry, which is the state level agency that has to do with our labor force, our employees, Office of Superintendent of Public Instruction, the Health Department. All of them came together and provided us additional clarification about some things. Masks, for instance. We are fortunate that we have been looking at the Labor and Industry document for a long time. One of the things that has become clear, the shift from in labor and industry from a moderate risk to a low risk when you can maintain 6 feet. I just had a long conversation with our teachers. It wasn't long because we only had an hour, but I had just had a conversation with our teachers about the fact that as a former elementary teacher, it would have been challenging for me in a classroom environment to maintain a 6-foot distance consistently through the day. I just feel like it's challenging for us as educators to do that. So we're fortunate that we have a large supply comparatively to other school districts of KN95 masks. We were, I think, on the front end of thinking around that. So we have over 70,000 KN95 masks that are moderate level risk supportive. And so even though the health department changed the risk factor for our employees from moderate to low, and have said that low risk just has to do with a cloth mask, we have KN95 masks available for our teachers that feel like they're not going to be able to consistently maintain that 6-foot distance. So that puts us in a good place. The other thing in planning that we have is that if there is an identified COVID case at our building, let's say next week when we bring kindergartners back, we suspect or we identify a student as being symptomatic of COVID symptoms, we have a protocol in place that requires us to supervise that student in a COVID designated space. These are not our health rooms. This is a different location than our health room, because we don't want to restrict access to our health room if we put someone in there with COVID suspected symptoms. We want to continue to be able to serve our students with our health room, our Band-Aids and our other pieces, our ice packs and those things that are available in our health rooms. But we have a COVID designated space to isolate that student or isolate that staff member. And the person that is going to supervise that has to have an N95 mask. And we are currently fitting our employees. You have to be fitted for an N95 respiration mask. Employees are being fitted for those now. If there was a circumstance that we didn't have an employee who had the fitting and the process for an N95 mask, we have visors, the shields, and a KN95 mask, which has also been identified as an additional level of PPE to be able to manage a student, again, who is symptomatic. A piece of that is this concept of this attestation form. And we have really been working through this mantra of go slow to go fast. We know that this is really incumbent. And as I did in our previous meeting, just a shout out to our elementary staff and our kindergarten teachers particularly, to really be able to help us to learn how all these processes go. We've been talking to districts like Sultan. This is their 3rd week of kindergarten this week, and we've been talking to them. One of the challenges that they have is this attestation form. And essentially what that means is that we have documentation from caregivers that the students are asymptomatic. They don't have those symptoms of fever or sore throat or nausea or diarrhea or any of those things that have been associated with COVID, and that they're attesting, the attestation, they're attesting that their child is safe to come into our buildings for school. In order to load the bus drivers will need to have that attestation form handed to them in order for the student to ride the bus. If you're choosing to drop off your student at school, you will be required to either hand the attestation to the staff that are awaiting there for our students, or to either go through a screening process at that point or simply fill out the attestation. So this is something that's been a challenge with other districts. We know that it's one of those things that's going to be tough to manage. But again, all of our staff coming into buildings, we've had that process in place. We've learned based on our previous meeting that we're gonna revisit that with some of our schools and make sure that those processes are happening in place. And we're gonna continue to look for ways that are simplified. We know that the Washington State Health Department has heard from the schools that are currently in phases that they've been able to serve students longer than us. And they understand that this is a challenge. So if there's changes to that, you will know that. I'm going to continue to look up at the questions here. I've got a dual screen thing going here. So looking back, the question about this whole concept of when we finish the first quarter on November 13th, and when we look to hybrid on November 16th, then being that Monday, what is that going to look like? Is that going to be 1st through 5th? Again, we don't know that at this point because of the shift. For those of you that are paying attention to the COVID numbers in Snohomish County, again, our county numbers drive that decision. So right now we are in the moderate risk when you look at that decision-making tree. Decision-making tree is available on our website for you to examine that. You can go to the Snohomish County Health Department website and go to COVID and go to schools. You can see that same document there. Right now, we're Snohomish County, after the Labor Day, we did go from about 42 cases that did climb the next 2 weeks after Labor Day, we went up to about 46. And then this week we went up to about 54. I had a meeting with Department of Health, Snohomish County Department of Health yesterday with other superintendents from around Snohomish County. Dr. Spitters at that point said, continue with your initiated plans. For us, that means preschool, developmental preschool, and kindergarten on Monday. Said, before you do anything after that, let's continue to watch these trends and see what happens. And so again, if those numbers continue to climb and Snohomish County Health Department changes what they do, we are responsible to respond to that. That is a decision the board will be faced with. But again, take a look at that decision tree, and you'll see that, for example, our special education students, if we were to go back to that high level, which is above 75 cases per 100,000 in that 2-week period of time, we could continue to serve those students because they're farthest from educational justice. That's the language that's used on that document. So take a look at that document. We have the documentation that you received. I just want to reiterate, if there's a case at school and we go through the protocols of isolating, let's say it's a student case, and we isolate that student at school, all of that is reported to the Snohomish County Health Department, and the Snohomish County Health Department, much the same as if we have a measles outbreak or a chickenpox outbreak, we are always partnering with Snohomish County Health District in those situations. This pandemic is no different. Our contact person for that is David Parator. He is our Chief of Student Services, so he oversees our categorical programs. So that's like Title I, and he oversees our special education and our 504 accommodations. And in addition to that, he is our health officer. So he is in direct contact with the Snohomish County Health Department. And were we to have a case at one of our schools, we would follow the protocols that you have been emailed now and you have received as parents. Again, those are available online as well and on monroe.wednet.edu, our website. You can take a look at those materials there. We have protocols that are in place for when that happens, if that happens. And again, we will be guided by Snohomish County Health District on what our next steps are. We are working to cohort your students. So if you are a parent of a kindergarten student, we are considering our classrooms as cohorts. We made the decision to staff our kindergarten classes in pods that could fit in our classrooms, or in some cases, other areas of our schools. And those are our pods. Some of those decisions are clear. I see a couple of our kindergarten teachers are in this, and so they know that their classroom is their pod, and they've been moving desks around and getting that set up in the 6-foot social distancing. And were there to be a case that the Snohomish County Health District decided that we needed to quarantine a classroom or a cohort, then we would have to quarantine that cohort. So we're trying to think of this in ways of protecting all of us from having to, you used in my head, I'm thinking of Frylands Elementary. So instead of letting our students mix together, classes will be going out to recess by themselves. And when they're out there, they take their masks off, they socially distance, they wash their hands. When they come back, they put their masks back on. And then we try to limit as much of that exposure as potentially possible. I just want to share with you, we've had a case of COVID with a district level administrator. We worked with Snohomish County Health District. We had to quarantine 14 staff members that were contact traced to have direct contact with that individual. I truly believe that because they were wearing their masks, because they maintained socially distance from one another, none of our quarantined adults that were involved in that circumstances contracted COVID after that case. And so we hold that up. We held that up to our staff in the previous webinar. I hold that up to you as our community. We are following the safety protocols that are in place, and the concept that I talked about with our staff in the previous webinar was this reciprocal accountability, helping ourselves to stay accountable to those safety protocols. Looking up at the next question, with kindergarten coming back, what specifically are you doing to keep students and teachers safe? What detailed plan for their safety has been put in place, and where can the public view it? Again, that document went out today. We had to modify that document based on that guidance that we received on the 30th. As I've said in some other of my communication to parents who have emailed me, this is such it changes daily. Things that happen, we get this guidance, we act on that guidance, and then we get different guidance that changes what we can do here. Masks, for example. We originally thought that all of our staff was going to have to wear KN95 masks in the classroom, purchased a boatload of KN95 masks, and now the guidance that we received on the 30th says that if a teacher can consistently keep a 6-foot distance, they can wear a cloth mask. You know, as I shared with our staff previously, as an elementary teacher, I think that would be challenged to keep a 6-foot distance from my students. So if I were in a classroom right now, I would take advantage of the KN95 PPE that we have available for our staff, and I would wear that so that I didn't have to kind of think in my head, oh man, I got to stay away from these kids all day. So we have a published document. Greg Burns is our Director of Safety and Risk Management. Greg has been integral in our planning, along with Devlin Piplick, our Director of Operations. If you take a look at that decision-making tree, there are some things that are very clear guidance. We have increased the circulation in all of our school buildings. We have increased the filter size, and we have maximized the airflow based on that increased filtration. And so we have different airflow than we did, a year ago in our classrooms. School buildings are required to have a minimum of 3 air exchanges an hour. And so our system is set up to exchange the air from outside air to inside air at least 3 times. We have pumped that up. We have increased that. So we have different airflows in our schools. We have cleaning protocols that have been mandated. Again, shout out to Devlin Piplick, our director of facilities. He's been working with our custodians for them to understand what those stipulations and requirements are for both cleaning and sanitation. We have purchased different equipment. We have electrostatic systems for our buses to clean our buses. We will use those systems if we have a COVID case and need to isolate a room until it can be deep cleaned with those disinfectants. All of those things are aligned with EPA, Environmental Protection Agency, and we are clearly bound by all of those agencies to make sure that those chemicals are safe and that we're using those chemicals that have been identified by those outside agencies. We have a question that how many kids are failing now? Will schools survey their families and distance learning? Kim, you know, one of the things that came out of our summer reopening was one of our tenets, and our tenets are in that guidance document that you've all received now, is that we would be flexible for families. So Kim, as our Chief Academic Officer, again, I'm going to let you talk about this one and take a look at some questions as you answer that one. Thank you.
Thank you. So grades should be communicating what students know and are able to do. We are working to ensure that our student grades do not include behaviors like absences, late work, and stuff like that. And while those things are important, while those things need to be noted, and while we should be having conversations with kids and with families about those are things that should not be included in a grade. And so this is definitely a work in progress. And we know how important that is right now because kids are struggling to get online or struggling to try to manage home life and with Zoom meetings and all of that. So with that said, one of the things that we are doing right now is looking at the data to determine how many students that is and why they're failing. We're trying to understand the scope of the problem before we start applying solutions. Just in general, what I do know is this could be a function of a teacher entering a missing assignment and having it count as 0, and that brings down the grades. Then the kids will do the assignment, it gets put in, and it brings it back up. It could be that there are only a few assignments that have been assessed, and a failing grade brings down the whole average. And as kids do more work, then it will come up again. But whatever the reason, our school leaders are aware of the issue, and we are committed altogether to solving the problem because failing grades should be few and far between, and the impact of failing grades on student motivation is powerful, and we know that. So we're going to continue to look at the problem, find a solution, and communicate with students and families around this. If you do continue to have concerns about your student's grade, please contact your teacher. They are so happy to be able to partner with families, and it's something that is even, fortunately during this time, has become even a bigger opportunity for us, is to partner with families in teaching and learning. So please contact teachers, find out what's happened, and then where you can collectively come up with a solution to improve outcomes for kids. I think the second part of my question has to do with surveys. And so I'm just going to go ahead and answer that, Justin. And it was, will schools survey their families on how distance learning is going? Yes, absolutely. We promised you that we were going to do this, and we still are going to do that. What we wanted to do was just give the system time. That includes your systems at home and our systems at school to really work out the bugs as much as we can. And I'm guessing that in the next few weeks, what we're going to be doing is working with our staff to come up with a survey that we send out to families and make sure that we're capturing information that's going to be needed to make changes.
Thank you, Kim.
Yep.
I think as I was listening to Kim answer that question, I think one of the things that I would just really emphasize is, you know, if you are a family and your child is struggling, please reach out to your child's teacher. If you have reached out to your child's teacher and you feel like the support hasn't been there, reach out to that building principal. Just, you know, follow those levels. We like to solve problems at the lowest level we can. So again, classroom teacher first, talk to your student's teacher. Our teachers are in it for kids. I am so proud to be in Monroe, and I know, and I don't want to discount how challenging this is. I was at a family gathering, and I have nieces and nephews who are in the school systems And this is really, really hard. And that's why again, if we can all do our part, get that count below 25 in Snohomish County, that would be very helpful. There's a question that we have about masks. Masks are mandatory for students to wear. And the question really says, what are you going to do when a kid comes to school and, maybe this is an anti-masker family or something, and so the kid's going to demonstrate that. Well, here's the thing is that masks are required in school. Now, there's a couple of things there's some nuances there. If this is a student that has a medical situation, there are other accommodations that we're able to employ, like a face shield for those students that are simply not able to wear masks. Some of our students are asthmatic. They have doctor's notes that say they can't wear masks. And so again, face coverings are required. That's again, required on the buses. And that is something that we're going to be working with families, just as we would with any non-compliance behavior in our schools. We hold ourselves up and as I say to my staff and my teachers and my principals, we are experts in education. And we need to work in those situations when there is non-compliance as experts to make sure that we understand why the behavior is happening and we work to solve that behavior. I think, worst case scenario, if you think about that, students have to wear their masks and we simply can't have a student that's not wearing a mask put our other students in jeopardy of losing that opportunity for in-person learning, or our teacher or our paraeducator or our principal or our secretary in our buildings or our bus driver of losing that opportunity to serve students in person. We know that this challenging situation in remote learning hasn't worked well for a lot of our students. And I want to do everything we can to get our students back in our schools. Part of that is to pay attention to this. And I know that I live in this community. I live in Washington State. I know there's those that believe the mask protocols, and there's those that don't. And I would just hold up our experience here in Monroe. We had a situation with an absolute positive case of COVID. And that individual had multiple interactions with 14 of our district level office personnel, enough that the Snohomish County Health District directed us to quarantine those individuals. None of those individuals contracted COVID. We believe that has to do with the fact that they were 6 foot distance and they had masks. Both parties had masks on. So I'm just answering that question directly. Students are required to wear masks. They will have mask breaks. Recess does not require masks. Again, socially distant. I was a first grade teacher, so I'm looking at Allison Peckinpah. I see your name on there. Both of us have had this conversation together. It's going to be really hard herding cats to make sure that our students do that. But again, we're teachers, we're educators, and we're going to continue to work with our students, and we want them to be here with us. And so we want to do everything that we can to make sure that happens. We have a question about cohorts on buses. The interesting thing is that buses require masks, but they don't require cohorts. That being said, Mike Birch, our Director of Transportation, is working really diligently not to overload our buses. So we're working on routes that allow us to spread students out on the buses. We've been advised by OSPI to have ventilation take place on those buses. So have the windows and vents open when possible. All of you live in the Monroe area, Monroe, Malpe, Snohomish area of our school district. You know that I've described to people, where do you live? Well, when you see that Doppler green dot on King 5 weather, I live right there underneath that Doppler convergence zone. So we know that there's going to be some wet days, but again, students washing hands, having access to hand sanitizer when they get on the bus, having their masks on. The buses are going to be cleaned. But it is not a cohort situation. Question about specifically around Snohomish County and the health district. So the Center for Disease Control, which is the national health agency, they have directed states to use county data, and Snohomish County is the same way. Our health district is using county data. You're probably heard of heat maps, and that is done in a county where they look at zip codes. So our zip code 98272 and rates with that. Last week, the last 2 week count, Monroe was hot. We had We had higher cases in Monroe than Snohomish County. But again, the decisions around the guidance from our Snohomish County Health District is based on a county number, not specifically to a Monroe number. So we know, good news is that this 2-week count, the Monroe countdown went down as well. Part of the reason why Dr. Spitters is suggesting that we continue moving forward with our plans that are in place now is because hospitalizations are down. The hospital capacity, those individuals with COVID that are hospitalized, that trend line has been going down for the last couple of weeks. So there's hospital beds available. And so, taking a look at the cases, taking a look at the hospital beds, and I just have to name the irony that as a person with a doctorate in education, I am talking to you about health counts, but that is the world that we're living in as educators now, is being students of the game of education and also being students of the game of public health. And our number one priority is to make sure that our students and our staff and you, our community members, remain safe. And so all of those things that you're going to read about all of the things that we have to do as far as cleaning protocols and social distancing and signage and all of those things are in play and moving right now to make sure that we have them all in place when we continue to bring our students back and bring them back into the environments where we're confident that we can comply with those things that have been established for safety. I do want to say, just like Dr. Spitters has said to us superintendents and our staff members that are involved in those meetings, it's not going to 100% prevent potential transmission. It's likely that the more individuals we bring back into our buildings, we will be dealing with cases of COVID. And again, we will be aligned with Snohomish County to do that. Next thing I want to talk about is our free and reduced form. Our free and reduced form is online. And I think one of the challenges that we have had, and I know that many of you on this call have been impacted by COVID and this pandemic and potentially have been impacted financially. I would highly recommend that you engage in the free and reduced process and determine if your family meets those requirements. There's a lot of things that will happen with that. Realizing that anyone can get food now at our locations that we're distributing food at, that there is no monetary exchange or free and reduced requirement to have that exchange. But that waiver goes until December. And we're not confident that the waiver is going to be extended beyond December because there's not funding that has been allocated for that. So when we get to January and we begin to serve meals in January, that could be a monetary exchange. So if you were a free and reduced family last week or last year and you haven't renewed your free and reduced because you're like, well, there's no reason to because my kids can get free meals, I'm extolling you. Please, please, please fill out that documentation. If you're a family that has financial circumstances that have changed from last year to this year, please look on the website, see those documentations, talk to your building secretaries. All of us are here to help you and to figure out if you are eligible for that. If you are eligible to that, the Office of Superintendent of Public Instruction has dedicated CARES Fund money, and they've allocated CARES Fund dollars that families that qualify for free and reduced lunch can receive basic internet services to their homes now too. In order to qualify for that program, you have to have your free and reduced. We have to tell OSPI that you are a free and reduced family from our district so that those two things are coupled. So if you are a family that is having those challenges, I have a question. We've received questions about, well, what if we're just on the cusp, we're not free and reduced? We need to hear from you through our buildings for how we can support you. One of the things that we've been talking about with our union, one of the things that we've been talking about with our building principals is this concept, concrete school district. Many of you have driven Highway 20. Concrete school district serves Highway 20. One of the things that they've done is they've set up internet cafes at some of the, what have been, visitor centers. They're actually setting up hotspots in visitor centers to have their kids come in and be supervised and have the access to internet that way. We're considering that for our schools. We're considering having students even transported to our schools who potentially don't have internet access and may not qualify for these services. We're trying to remain creative on that. We're trying to make sure that we continue to serve you and your students out there. And we know that obviously one of the biggest challenges that we have in an online environment is making sure that there's stable internet connectivity. If you haven't read this or heard this on news broadcasts or anything, we know that this is the next piece of equity that we need to really work on as a state, as a country, is to make sure that all families have access to the internet, who want that, who are able to utilize that and continue to benefit from that. So that's one of the questions. The question around here is if there's an uptick or exposure symptoms, if Snohomish County goes up again to that high risk zone, could schools close? Yes. And that would be the directive of the Snohomish County Health Department, and our district would need to comply with that. One of the things that I would suggest, again, going to that decision-making matrix and tree, is that even in the high risk category, students who are farthest from educational justice, so part of that would be our special education students. We would advocate that our kindergarten students, we could continue to look at serving them if the factors in Monroe were, again, safe, and we were advised by the health district that they would continue to advise that. So that's part of that decision-making tree again. So jump onto that decision-making tree. Again, it's on our website. It's on Snohomish County Health District. Click on the schools button under their COVID page, and you can find that. I'm going to really quick look at the questions here and continue rapid. Make sure that I'm unmuted. I'm sure many of you that have participated in Zoom have heard this over the last 6-7 months. You're muted. One of the questions is around families. We are running a Skyward report that has to do with households. And households we believe captures families that might be split families. So with some custody things. So what we're working to do is to make sure that our hybrid model, so our A-day students, are from the same household, K-12. So we're working on that right now to make sure that that's clean. Our plan is to communicate out those cohorts and then allow some time for us to be able to respond. If you get the letter that, one child's A and one child's B, we need you to contact us and let us know that, because our goal is to have households in the same cohort, so that as we continue to get healthier and healthier as a system, as a county, and when we're able to bring back our secondary students, that we're not impacting families by having one kid on one day and one kid on another day, and then trying to have to balance that with all of those balls that you have in the air. We're trying to be intentional. We're working to be intentional about that and make sure that family units are aligned as far as the cohort goes. Question about 612. I don't think I've addressed this, and it's important for me to address this. The guidance that we have right now from Snohomish County Health is elementary. Focus on our plans for reopening elementary schools. Part of this has to do, if you go to the Snohomish County Health District website and you take a look at the data that they're presenting to us, they break down age 0 to 12. The health community categorizes that as I'm going to use the word cohort, and I apologize to anyone medical out there. So that 0 to 12 is a cohort, and then that 13 is kind of that mid-range, but 14 and up. So it's actually 0 to 14 is they look at the rates of COVID for 0 to 14, and then they look at like 14 to, I want to say 20, early 20s, and then there's another range above that. And so our secondary students, it's very clear from the guidance we received from Dr. Spitters, you might have read that in the Everett Herald, that it is not time to bring our secondary students back. That being said, we're looking at what that cohort model looks like. I had a meeting at the high school this morning the administrators from Monroe High School and our administrator from Leaders in Learning and also Monroe Virtual Learning Academy. Blake Baird was there involved in this discussion as well, of really looking at that really intensive Rubik's Cube of a master schedule at a high school. So we have just over 1,400 students at Monroe High School this year. If you think about an A and B cohort, that's still over 700 students. And 700 students, and trying to ensure that they have the right math classes, the right science classes, the right electives, the right CTE, all of that in order to maintain our graduation pathways. I know that one of our assistant principals, Jeanette Seamers at the high school, told me today that she's actually reached out to the math department because it's actually a very challenging mathematical equation. Again, we're working on those things right now. I suspect that could likely cause us to have to hybrid that after the semester, but looking at opportunities based on the guidance from the health department, for example, 6th graders, 9th graders, even our seniors. I met with our representative, our senior representative on our school board, Brandon, this week, and just talked to Brandon about the experience. And we talked about, many of you know that my daughter was a 2020 graduate, and having lived through that last year, having her graduate, it's very challenging to be again in this situation where we're unable to move forward in that until the health department deems it safe to do so. So I just wanted to address that question. Portable classrooms and hand washing, it's an either or. And so we obviously our preferred methodology of hand washing is with our sinks. We know that even in talking with our elementary staff members and seeing, we've got a number of elementary teachers on our conversation today, we don't have enough sinks in our elementary schools. Pre-COVID, one of the things that we knew that we were going to have to work on was sinks at our elementary school, because legislators are thinking about making students go to recess first and then lunch. There's a lot of evidence about that, about how much better that is for kids. And a lot of districts in the state have done that. The challenge that we have is we don't have enough sinks. So bringing our students in from the playground, and this, again, pre-COVID, hundreds of kids to wash their hands. We know that we have to do that. So our existing facilities, we have sinks. Our classrooms have sinks. But again, when you start to have a cohort come in with 14, 15, 16 students, again, as a recovering first grade teacher and having had to teach procedures of how to use the restroom and how to wash your hands, it takes a long time. And we're really trying to maximize that time in the classroom with our instruction. We will have a hand sanitizer that meets the qualifications of more than 60% alcohol based in there. And so that is our answer to that question as far as hand washing. So I'm taking a look at our questions. Hang on one sec. We'll see where we're at. So one of the questions that we've been receiving is about testing, and as an institution or as an organization, are we going to be testing our teachers? We have the same requirements as I talked about as far as the attestation for you and your families and your students. Our staff has been required upon entering buildings, and for those of you that have been to our buildings, we have an attestation form for our visitors as well. So we are doing screenings upon entry. Or we actually have in our Skyward system, there's actually a module in our Skyward system. That's how I'm completing my attestation every day, attesting that I am not symptomatic, I am not feverish, I have not had any of the COVID symptoms. And then we have again, a module in our Skyward system that allows us to do attestations online. Some of our staff are doing that. Some of our buildings have Google Docs that the building secretaries are managing. Again, this is something that we're going to continue to learn and grow as educators. That's one of the things, that's one of the hallmarks of our profession is innovating. We can't stay stagnant. We have to continue to be learners. We have definitely engaged in a learning stance with all of these requirements. So we're not testing at this time. We've been learning about the, I again, I apologize to all of my medical personnel out there, nurses, doctors, medical professionals. I apologize outright for me delving into this. But there is group testing that can be done that's a little more quick. And what that does is it tests a sample of people, 10 to 12 people. It's a cheek swab. And there's a lab in Bellingham that has been doing this. And I know some school districts have done that. When they get into situations that are a little bit outside of the normal process, and if they're working with their health department, some of them have deployed that to their staff. What that does is, it takes a sample of a group of people. They do cheek swabs. That sample is then tested. And if the sample comes out positive, then those 10 or 12 people then get the more invasive COVID test to determine who in that pod, who in that group has COVID. So we know that that's available to us. Again, that's a lab in Bellingham that I've learned about that from. We are not using that at this time. We are following the attestation process, but again, we have that in our hip pocket in case we have a situation or circumstance that we deem it important for us to deploy that. Taking a look again. Again, Dr. Spitters, the meeting with Dr. Spitters yesterday, he did talk about, we have a question out there. Dr. Spitters was on a radio program, and in his professional opinion, we are on a third COVID wave. I talked about this a little bit. We were all aware that coming out of Labor Day, we could predict, because we had seen the uptick after Memorial Day. We had definitely seen the uptick after 4th of July. 4th of July, when we went up almost to 100 cases per 100,000. So we anticipated that we were going to see an uptick after Labor Day. We have. We're watching that closely. But again, Dr. Spitter's guidance to us was continue with the plans in place that you've initiated now. Put a little pause on adding anything to that. That fits nicely with the timing that we talked about in August. And the communication we made to families in August that we would review this at the quarter. Again, the quarter is November 13th, and then decisions would be made there. Obviously, we can't wait till the 13th to do that. That planning and that talking and that work with our teachers and our principals, our unions, all of that is taking place now, so that when we get to that point, if it is clear and deemed appropriate to expand our services to additional students, we're ready to go with that. And so, yes, we have been in conversation with Dr. Spitters about the third wave. That third wave is associated with Labor Day. So probably many of you, initially in this pandemic, I couldn't say that I knew anyone that had been directly affected by COVID. Now we can, right? Some of you have lost family members and friends. My sister in Anchorage and her family contracted COVID. They've recovered from that, thank goodness. But as we see these behaviors and things happen, we can predict. One of the things, so having two students in college right now, two different decisions for the different universities that my children are attending. One of my students is going to be home at Thanksgiving and will not return to campus, because they're predicting that because students are going to go out, they're going to bring the COVID back to the campus. And so that university has determined that they will complete first semester online from Thanksgiving on. My daughter's school, the decision that they've made is if students choose to leave Spokane County, they cannot return to campus. So that's a decision that's a tough one as a parent, that my daughter wants to stay at school and she wants to complete her first semester of college over there in Spokane. And so we're trying to figure that out for Thanksgiving. But those are predictable events. When we have these times where events, right? Labor Day, Thanksgiving, we have a couple of events coming up. We have Veterans Day coming up on the 11th of November. So a lot of businesses will identify that. School will be out that day. I think all of us just need to be smart about the choices that we make and make sure that when we do make those choices that we're following the guidance that's out there and minimize the impact we have on our community. So we have a question, will children be able to go in person if exposed to someone? How will you confirm this? part of the attestation process, one of the questions that is part of the attestation process is, has your child been exposed to a COVID positive person? And so we're relying on all of us to be honest, to, that whole concept I talked about at the beginning of this webinar, that reciprocal accountability, right? All of us working together to make this work for our students and to do everything we can to get them back. I think we've all learned that there's that gestation or there's a period of time that, you could have been exposed, but you're not symptomatic. And the worst thing that could happen is, we have someone that's asymptomatic, but spreading COVID come into our environment, and we'll have to deal with that if that happens. But I think all of us need to do our part. If we know that we've been exposed, the second part of that question is, how will you track that? We're working with our building offices are going to track the attestations. David Parator, our student services chief, is going to be working with Snohomish County. We're going to be working in collaboration with Snohomish County to track those cases. And Snohomish County has been in contact with us as we become aware of students in our community that have tested positive for COVID. That information is shared with our schools. Snohomish County Health Department has hired contact tracers. We're working directly with that entity, and they've been in contact with us. If your family contracts COVID, you go and you get tested and you have a positive case, that information is relayed to Snohomish County Health District, and then Snohomish County Health District in their contact tracing process. One of the components of that tracing process is to contact our schools. Next question is about, is there enough staff to cover if we have staff members that get ill? This is a challenge for us. We are employing substitutes. So those of you that are on this call that maybe have served as substitutes for us in the past, we are providing a higher level of PPE for substitutes. We are considering, because they're not going to be cohorted, right? They're not, if I'm a substitute, I might work at Frank Wagner Elementary one day, Frylands Elementary the next day, may go up to Maltby Elementary the next day. And so one of the things we're working with Greg Burns, again, our Director of Safety and Risk Management, is really making that determination around what level of PPE is appropriate. And we're considering that to be on the moderate to higher risk, because we don't want a substitute to be that spreader, right? We don't want a substitute to cross-pollinate. Again, I just apologize to all of you medical professionals, but we don't want that substitute to potentially work one day at Maltby and then go to Frylands the next day and take out two of our cohorts. So one of the things that we're going to do about that is to provide a high level of PPE for our substitutes. Potentially a KN95 mask and a shield is something that we've been thinking about, and then really encouraging and endorsing that individual to just really be careful. Be careful about social distancing. Wash your hands. Wash your hands. Wash your hands. And be really diligent about that as they move. We really love our substitute teachers. We've had great substitute teachers in Monroe that my former role as executive director of HR, we just have had a real solid cadre of individuals that have supported your children and have stepped in when our teachers are ill. We do have some contingent plans of potentially deploying other staff members in the case or circumstance where we might not have substitutes to do that. So it is we call that a problem of practice, the practice of education. That's one of the problems of practice that we're engaged in, that obviously we haven't had a lot of experience with that because we've just been serving, like I said at the beginning of this, around 100 students in all of our buildings, students that are typically individual education plan students that are served with IEPs. But as we have kindergarten students come back, we know that some of our kindergarten teachers they're going to do their part in keeping us safe. And if they're symptomatic, if they have a sore throat, if they have a runny nose, if they have any of those symptoms that are COVID related, they're going to identify that and they're not going to come to school. And that's a tough thing, I think, as a culture. If you just think about walking down the drug aisle in Fred Meyer, there's products like Dayquil, there's products like, Theraflu, there's products that have been out there to mask symptoms in order to get us to work. And I'm just extolling all of us that are participating in this discussion and conversation webinar today, that we just can't do that anymore. And so our teachers know that. We're depending on their honesty and their ability to be honest about that. Sometimes as a teacher, I can tell you in my history as a teacher, sometimes we just think to ourselves, you know what, it's going to be easier just to power through that day. It's easier than making those sub plans. It's easier than that. But you know, we have to change that behavior, because that's not what's best for the community of Monroe School District. And as I said to our teachers previous in our last, it is Team Monroe. And as a team, teammates look out for the best for each other. And that's what we're doing as a community here in Monroe as well, is we really need to do our part and do our best to do everything we can to continue to drop that number, so that Snohomish County Health District, we get below 25, they tell us to continue bringing kids back to school, and we can do that. Taking a look at the questions here, one sec. So last question here, and then we've got to jump off because we got Monroe High School that needs this. They need our subscription to Zoom here for their curriculum night tonight. So some of you are going to be jumping in there. How are the students? By all indicators, what I've had, Melanie Gray is an assistant principal on special assignment. She's one of our staff members that actually went up and observed that. And Melanie's report to us that, you know, obviously it's odd to see students back in rows and masks and things, but it was great to see kindergartners in the classroom. I have family. Many of you know that my children were actually third generation graduates of Sultan. While my mother-in-law was the valedictorian of Monroe High School, my father-in-law was a graduate of Sultan High School. And my wife graduated from Sultan, and both of my children graduated from Sultan. So I have a strong connection. I used to be, at one point in my career, was the building principal up there at Sultan Elementary School. So we have a strong partnership with Sultan. In talking with Dan Chaplick, things had gone well enough with their kindergarten that they were able to bring their first graders back on Monday this week as well. So I think the children are doing well. They haven't had problems with mask compliance. I think that's something that as adults, we worried about a lot. How are kids going to wear these masks? Dan Chaplick has told me that has not been an issue for them at Sultan. They have about 100 kindergartners that they brought back to Gold Bar Elementary and Sultan Elementary. And like I said, they introduced their first graders back this Monday. So I think the kids are doing well. I'm going to have to wrap this up so we allow our high school to do this. I appreciate all of your attendance. It looked like at one point we were up to around 60. We got about 50 of you on there. Thank you very much for, again, supporting our schools, supporting our teachers. I'm just honored to be your superintendent, and we'll continue to work hard for the kids of Monroe, and let's continue to be safe and get our kids back in our schools. Have a great evening. Thank you very much for participating with us tonight. Thank you.